Good morning, and thank you for joining us today for our free webinar, Tips and Tricks for Telemedicine Insurance Billing in Colorado, featuring Sarit Hirschkorn. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. With the current state of the acupuncture profession, the nation, and the world, we have decided to add our webinar offerings to bring in experts in telemedicine, practice management, and insurance billing, in addition to our traditional clinical skills-based webinars. Our guest speaker today has graciously agreed to offer sessions each day for specific states so we can focus the content and share the most relevant for you. I will just go through a few housekeeping items now. We recommend viewing the webinar in Chrome, Firefox, and Safari, as you may experience some slowness in other browsers. If you experience any freezing or delays in the video stream, try refreshing the page. And if that does not work, we would suggest trying to watch in another browser. Everyone who registered for this event will receive a link 5 minutes after we conclude to watch the webinar on demand. And lastly, we will be holding questions till the end. If you have a question for our guest speaker, please use the questions tab to assure that we ask it at the end. To communicate with other attendees or to communicate technical difficulties, please use the chat tab. Now for our featured speaker, we are proud to introduce Sarit Hirschkorn. Sarit is co-founder and co-owner of AllAcuServices LLC, a company specializing in insurance billing services for acupuncturists, massage therapists, naturopathic doctors, chiropractors, physical therapists, and social workers. After spending nearly 2 decades working in corporate benefits outsourcing for multi-million-dollar companies such as PricewaterhouseCoopers, ACS, and Mellon Bank, Sarit now applies her knowledge and understanding of the insurance industry to the field of insurance billing for holistic healthcare providers. Please join me in welcoming Sarit.
Thank you, Jeffrey. Good morning, everyone. Good afternoon. As Jeffrey said, my name is Sarit Hirschkorn. I'm the co-owner, co-founder of a company called AllAcuServices. Our billing, our niche is acupuncture, and my partner, Robert Vena, is a licensed acupuncturist in the state of New York and in New Jersey. What I want to do today is I want to go through what telemedicine is. I want to go through some terminology, so telehealth, telemedicine. I want to talk about what can we bill for as an acupuncturist, so what falls under the telemedicine umbrella, how often we can bill for telemedicine, and then we're actually going to talk about the codes that we can use for telemedicine, and are there modifiers. So we'll walk through the different codes that are available and how we are going about billing them. I want to give you also a formula to figure out what to charge for these codes based on your current pricing that you charge for acupuncture. We'll talk a little bit about HIPAA, and once we're done, we'll go through questions that you have available. Any questions that we don't get to answer, we'll take them as a takeaway, and we will get back to you with the answers. So I would like to get started just with some terminology so we all know what telemedicine is and telehealth. And then we'll talk about some logistics of who is actually covered for this telemedicine and how often can you bill for it. So we'll start with telehealth. Telehealth is the use of electronic information and communication by a provider to provide services for their patients. Things such as assessment of diagnosis, consultation, treatment even, education, care management, and self-management of the patient. That is the big, large umbrella of telehealth, where telemedicine is an avenue or a portion of telehealth. Telemedicine is the use of emails, faxes, texts, live stream video, and a phone to connect with your patient. It does have to be patient initiated. And you say to yourself, well, how is a patient going to initiate these services? Well, you can let your patient know that you are performing medicine. Also, this is a really hard time for many of us. And some of us find it very, very stressful. A lot of us find it very, very stressful. It would be a good idea if you reached out to your patients and let them know that you are there for them, find out how they're doing. And if they want to speak to you, you can schedule time with them and make that appointment for the telemedicine. So you could send out a global email to everyone, let them know you're available, and by the way that the patient reaches back out to you, that is considered patient initiations. You look at telemedicine, when you are having that conversation with your patient, it is considered as an evaluation. When you are providing that assessment, that consultation, it's considered as an evaluation and not considered as acupuncture. And us as an acupuncturist, there's many, many things that we can do besides just being hands-on with the patients and putting in needles, right? We can put in ear seeds, we can do tuina, gua sha, etc. And we'll talk over what are the things that fall under telemedicine that you can do while you're not being in a room. We have to keep in mind that we have to provide the same standard of care while we are sitting at home and the patient is on the other side of the screen. The law says that in telemedicine, the patient has to be an existing patient that is already under your care for either acute or chronic pain. But you'll see that the insurance companies are allowing a lot more than just existing patients, and we'll go over it in a couple of slides. They are allowing patients that are even new patients and expanding it out to new patients because they do want to alleviate the number of patients that are ending up in the urgent care, the patients that are ending up in the hospital. If you do perform a phone call to your patient, and I'm not sure if some of you just scaled down or some of you are closed, but if you do perform a phone call to your patient, but then within 24 hours you end up seeing that patient, you cannot charge for telemedicine. You only will charge for the acupuncture treatment. I know many of us closed our office, so most likely you will not see your patient within the next 24 hours. I just want to go over a quick review of the laws in Colorado so we understand what is Colorado offering in terms of telemedicine. So Colorado does allow providers to perform telemedicine. It's not an actual restrictions. However, they are stating very clearly that whether you use the phone or whether you're using a live stream video, it does have to be HIPAA compliant. They want to make sure that the data is not compromised and the data is secure. They are also stating that insurance companies should not deny a claim solely by you using telemedicine. However, and there's always an however, they can deny it for other reasons. If the insurance company does not find it medically necessary, they can deny your claim. So just so you're aware what the state laws are in Colorado, okay? I also want to talk about insurance companies are allowed to exclude you from providing these services if they do not allow the acupuncture benefit. So if I call in on Jeffrey's benefit and Jeffrey doesn't have any acupuncture benefits, for the most part, Jeffrey will not allow to be seen by a telemedicine provider, specifically by an acupuncturist who's providing those services. So they do have the right to exclude it if the patient does not have that particular coverage. Okay. What can I do while I'm doing my telemedicine session with my patients? And these are just some ideas. You have to keep in mind that this is just like an evaluation. So you can discuss your patient's current condition. Any previous conditions that they suffered for, you can discuss. You can perform a tongue diagnosis, of course, right? Any stress relief ideas that you can give your patients, i.e. Tai Chi, Qigong, breathing exercises. You can either do it to them or show them a couple of exercises on the screen and give it to them. Also, meditation. If you want to sit with your patient and meditate together, if you want to give them advice on how to perform meditation, that's perfectly fine. Nutritional guidance. anything for immune system. If the patient wants to know how to have better eating habits when they're at home, I know I would love that, especially because I'm home. That's something that you can definitely review with your patients. Self-acupressure. So there's some points that you can show them on the body, any points, to help them with any pain or stress relief or headaches or etc. You can show them it as well. The use of hot and cold packs is also something that you can discuss with them. And even herbal consultation is something. So if you are sending your patients herbs, it's something that you can go over, cooking the herbs, providing the herbs, etc. The use of ear seeds. I have several clients that taken an ear chart and along with ear packets and have sent it to their patients, and they're spending the time on the phone or on a video stream showing their patients how to put in those ear seeds. And last but not least is any decision making that you're making prior to having that consultation with your patients or after. It's something that will go towards that assessment, and you'll see what I mean in a second, along with preparing and reviewing notes prior to your session, and then documentation thereafter also go towards that assessment. And I want to go over the actual codes and the actual times. For starters, telemedicine is measured in minutes, okay? The time that you spent preparing, writing notes on a session on the phone, all goes towards the time that you're going to count for when you submit your claims. So if I had a session with Jeffrey and my session was scheduled for today at 1 o'clock, at 5 to 1, I started reviewing the notes and preparing for that session, 5 minutes. Then at 1 o'clock, I met with Jeffrey for 10 minutes. We had a discussion. I showed him how to put in ear seeds, or we discussed how to cook his herbs for 10 minutes. And then when the session was completed, I then documented everything that I discussed with Jeffrey on a call for another 5 minutes. The cumulative time of all of this is gonna be 20 minutes, okay? And we'll talk about which codes you're going to use. So it's cumulative time. Now, these codes can be used once every 7 days. So if I go back to my Jeffrey example, right? I spoke to Jeffrey today and I prepared and I spoke to Jeffrey for 20 minutes. And tomorrow I spoke to Jeffrey for another 5 minutes. I count all the minutes used during the 7 days from the first time that I spoke to Jeffrey. And those are the cumulative minutes that I'm going to bill. You can either bill for, and we're looking here at 3 different categories. We're looking at categories of 5 to 10 minutes, 11 to 20 minutes, and then 21 to 30 minutes, right? And it's not that I'm using all 3 codes. I'm using one of the codes depending on the amount of minutes used. If you spent more than 21 minutes, it doesn't matter if you spent an hour. It doesn't matter if you spent 45 minutes. We're going to use the last code. Now you can see there's differentiation between the video conferencing versus a phone call, okay? And we see the 3 different codes for video conferencing depending on the time used. And then the 3 different codes for a phone call. When you're done with these sessions, make sure that you document them the same as you would have documented your evaluation sitting in front of a patient. You'll document either using a hard copy or using electronic submission. On your actual claim, and we'll have Jeffrey bring up a claim in a second once we're done going over this. On the actual claim, what you'll put in as a place of service, usually you put 11 for office visit. But on these telemedicine claims, you will put in 02. Now, it would be a good idea for you to take a screenshot of this screen because we are not distributing the PowerPoint presentation. but feel free to take a screenshot if you do need the codes or write them down. For a modifier, you will use a modifier of 95, which indicates to the insurance company that it was a telemedicine session. Now, how do I know what to charge for it? Okay, so what I did is I gave you above, right, on the top screen on the right-hand side, code 97810, which is one set of needling. And one set of needling has a relative value of 1.05. If you're not sure what a relative is, just for our discussion today, just know that it's worth, right, 1.05 in the from insurance perspective. And the number, you don't have to know what relative value means, but you need to understand the comparison to these other codes that we're actually taking a look at. So if you look at code 99421, in comparison to what you charge for your one set of needling, it's worth about 40%. So back to our example, if I charge one set of needling, one set, $100, and I'm trying to make the numbers super simple, you can charge for code 99421 about $40, and I'm rounding it down. Okay. If I'm looking at video, if you're looking at the video that session that was done between 11 to 20 minutes, so code 99422, it's worth about 0.86 or 86%. This is, I would charge about $80 because you can see it's worth 80% of code 97810. Okay, and going for our last code for video stream, it's worth actually more than one set of needling. So if I charge for one set of needling about $100, I would charge for that code about $120. Okay. Similar to that, if you're having a phone conversation, make sure that your line is HIPAA compliant. There are many services that do offer HIPAA compliant services via the phone. And you can see the relative value or the comparison to the one set of needling is very close to the video sessions. Again, about 40%, 78%, and a little more than one set of needling is worth. I want to show you what insurance companies are allowing you to do and what they're not allowing you to do. So we've been calling different insurance companies, and these are just some of the insurance companies that I have listed on here. We're finding that many, many, many of the insurance companies not only allowing providers to provide telemedicine, but they really want to make sure that your patients, they know a lot of people are not working, so they are waiving the copays, the co-insurance, and even deductibles. Some insurance companies are waiving it on even for out-of-network coverage. It would be a really good idea. This is just high level. These are for some of the plans that we have called. This does not mean that it's for every Aetna plan. It does not mean that it's for every Cigna plan, okay? Different patients may have different plans. If your plan is self-funded, they don't have to adopt and allow telemedicine. So again, it would be a great idea to call the insurance company or the patient that is interested and find out if they have coverage. You want to find out not only if they cover telemedicine, right? So when we make the phone call as a billing company, we really try to take all the measures and put them in place so there is a recourse if a claim does not get paid. A, do you cover telemedicine provided by a licensed acupuncturist? B, do you need a referral? Okay. C, okay. Who did I speak to? What is the call reference number? Write the date and the time that you spoke to somebody so you can always go back to that call. Based on the call and the reference number that you are taking down, that you are putting, they always pull that call as well. Okay. Are there, if you're looking, some of our, because these are evaluation codes, okay, these are not acupuncture codes, we're finding that many of the insurance companies are not reducing from the number of visits that a patient may have, okay? So if a patient has 10 visits, they're allowed for acupuncture, we're seeing that they're not taking away from these 10 visits. Furthermore, some insurance companies do have a visit limit or number of evaluation they are allowed to do per year. I know that companies like Health First maybe allow you to do 1 evaluation per year. Find out when you're calling if this takes away from the evaluation. Find out if you need a referral. Find out if you need an authorization. These are good questions to ask when you're calling the insurance companies. We're finding out that ASH is a third-party company that gets hired by large corporations such as Blue Cross, Aetna, Cigna to manage some of their plans. ASH, as of today, did not get any guidelines with regard to telemedicine from these insurance companies. So if ASH is managing your plan, as of right now, they decided not to allow telemedicine until they get the guidelines. Okay, once they get the guidelines from any specific insurance company, so for example, if they get the guidelines from Anthem Blue Cross Blue Shield of California, they will then determine whether they will allow it or not. But as of right now, they did not get those guidelines. I want to go through some of these claims here. We are finding that the Blue Cross Blue Shield of Colorado is allowing it. They are waiving the copays and coinsurance only for in-network providers, not for out-of-network providers. They started allowing it as of March 17th, and as of right now, they're going all the way to June 14th. So just because they're allowing telemedicine now doesn't mean they're going to allow medicine in July, okay? They have allowed telemedicine because of COVID-19. Insurance companies such as Landmark, right, have allowed it immediately that COVID-19 have started. However, they do not have an end date published right now. They're also not communicating an end date because they want to see how long this will last, and then they will determine the date. Okay. Cigna, I will touch on Cigna in a minute. Actually, let's move on to Cigna. I'm going to talk about Cigna. Okay, Cigna published on their site that unlike all the other insurance companies where we are told to use telemedicine codes, they would like for us to use the regular E&M codes. So for those of you who are doing your own billing, I will talk about this, how to do this in a second. For those of you who are not doing your own billing and you have a billing company do it, don't worry about writing down the codes. I'm sure it'll know how to bill for you. But for those of you who are doing your own billing, Cigna said to use regular evaluation codes, i.e. 99213, 99214, 99215, 99211, etc. The modifier, as you know it, should not be 25. The modifier should be GQ, okay, with an office location of 11, okay? So you're putting a 1-line item with that modifier, with an office with the start date and the end date. Office location is 11, evaluation 99213, and then a modifier of GQ. Their system currently cannot handle the telemedicine. They said their system will not be able to handle the telemedicine procedure codes. However, we as a billing company have built for Aetna and Cigna and Blue Cross. We used all the telemedicine codes because we wanted to see how they get processed. Cigna did process our telemedicine codes. We are seeing that they have an allowed amount of about $50 for Cigna. Aetna allowed about $70, and it kind of goes within that range. Keep in mind that these prices may vary on a state-by-state basis. The reason that it's going to vary is because it depends on the county they are in, the state they are in, and what's allowed and reasonable in the area that you are practicing. So that is how they determine the prices. What I want to do is, Jeffrey, and I'm not meaning to put you on the spot, but I will. I want to see if we can bring in that Cigna image on how to submit a claim, because Cigna actually was nice enough to put it on their site But while Jeffrey is looking for it and going to bring it up, I also want to mention that Cigna published on their site that not only allowing existing patients, they're allowing any new patients that are interested in having acupuncture performed or telemedicine, they'll allow that as well. Okay, so here is how you should complete your claim. You can see you have your start date and your end date, okay? In column C, where it says service location, service type of service, for all insurance companies, it will be 02. For Cigna, you should use 11. And then the CPT codes will be the CPT codes that and I'll talk about specifically for Cigna, you'll put your 99, 212, 213, 214, 211. So your E&M codes. And then for Cigna, where it says 95, you will put a GQ. For all other insurance companies, you'll use the telemedicine codes along with a 95. Thank you, Jeffrey. We're going to go back to our. I want to bring back. I'm not sure if I lost everyone. Oh, here we go. So I'm going to go to the last slide because I want to talk a little bit about HIPAA compliance. So while a lot of insurance companies are very lax with regard to the HIPAA, we are seeing that they are not really enforcing the HIPAA penalties. It would be best that you use a HIPAA client software. If you are using an EHR program, many of them do have telemedicine that is, or video conferencing that is allowed to be done through that system. However, I did publish in here some systems that are either allowing you service for 30 days or maybe they're allowing you a certain amount of sessions. So just something to take a look into. Skype, Facebook, and any other system, Zoom, are not HIPAA compliant. Zoom for Business is HIPAA compliant, but Zoom itself is not. So just do a little research out there. You can Google and you can find many systems that are HIPAA compliant that you can use for your practice. I am going to open it now for questions. And so, Jeffrey, I don't know if we have questions out there with regard to how to bill or going over again those codes.
All right. Well, thank you so much. That was very informative. And we don't have a ton of questions, which means that the information was extremely straightforward. So there were a few questions that I actually tried answering in the questions tab. So it was basically the first one: for those who do not bill insurance, can we see new patients starting with telemedicine or only existing patients? And then what about out-of-state patients?
So yes, you can definitely see your patients. For those of you who are not using insurance, sure, you can see new patients, existing patients. You are allowed to see your patients via telemedicine. It is not an issue, right? Our discussion today was specifically pertaining to insurance companies and how you should bill for telemedicine. But if you're not going to use the insurance, by all means, right? You want to help your patients, you want to meet with your patients, go ahead. It's something that is probably would help your patient if you reached out and had a session with them.
All righty. And I think for the out-of-state patient question, might be best to check with your acupuncture state board,
Yes.
just to see if they're allowing that. And you might as well ask them about new patients at that time too, if there's any problem or issue.
The new patients is really dependent on the insurance companies. We're seeing that Cigna is allowing it. It does depend specifically on the insurance, right? If you have a patient who has Blue Cross Blue Shield, call Blue Cross Blue Shield and ask them, because they're making a lot of leeway out there and a lot of exceptions because of COVID-19. It's not something that they may continue doing, but right now, because of COVID-19, they're kind of letting a lot of things slide. Because they want to keep people out of that, as I said, the hospital and those emergency clinics.
Okay. And then a question from Susan. I thought that you said that for Cigna, the office was 11.
That is correct. Cigna, the office visit is 11. That is correct.
Okay. So in what we were showing a normal form that was not for Cigna, and that's why the place of service was 2. Cigna would be 11.
Yeah.
And then Nancy's asking about Apple FaceTime being HIPAA compliant.
I don't know. I honestly don't know. You can check anywhere on, usually the system requirements will say if it's HIPAA compliant, right? So if you go to any application, you can check their system requirement. The system requirement will tell them if that software is HIPAA compliant or not for you to use it, but for you to use it somebody else.
So from the research that I've done and what I've seen out there is that in general, FaceTime is not HIPAA compliant, but right now HIPAA is not enforcing its rules. And they said that during this current, crisis that people can use FaceTime, but as soon as the crisis is over, practitioners will have to go back to using HIPAA compliant platforms. That's at least what I've seen out there.
Yes, and that is correct. That is correct. They're not enforcing the penalties for HIPAA compliant. Should you use HIPAA compliant software? Absolutely. You do want to do whatever it takes to protect your patient's data and really not let it be compromised. But if you can't get the software right now, use FaceTime.
And then are there any specific CPT codes that you can use to bill for herbs and moxa?
Okay, so I want to make sure there's no confusion out there with regard to what you're doing. Just like I'm sitting here with Jeffrey and I'm having a session with Jeffrey, I can tell Jeffrey how to use moxa. I can tell Jeffrey how to use his herbs, but I personally am not putting the moxa on Jeffrey, and I am not sitting in the office with Jeffrey. Therefore, it's considered as an evaluation, right? So if I go back, and I'm going to try to go back. Okay. Because we are not in the same room, they all fall under these evaluation codes that we call telemedicine because it's done via video conferencing. So yes, the same codes that you're using to just talk to Jeffrey, I will also charge for moxa. Whether I talk to Jeffrey about how to put in ear seeds, how to put in, to administer his own moxa, or how to even do acupuncture points, is what you're going to charge for this telemedicine.
All right. Next question. Anthem of Colorado is now processing through ASH. Can you confirm if they are still allowing telemedicine since ASH is not?
So if ASH is not allowing, Anthem of Colorado will not allow it. But then again, I don't say never, and I don't want to say as of right now, no, because I do see that every day these insurance companies putting in new information there. Cigna every day publishes on our site, Aetna, and so it could have changed. We checked yesterday. Today it could already be different information. So check, call and verify your patient's coverage, and find out your patient is interested in having telemedicine. If you are not successful, best is ask the patient to call in. When too many patients complain that they can't get to their acupuncturist via telemedicine, and they really need to speak to their acupuncturist, guess what? The insurance company will open it up. So there are your best cheerleaders.
All right, get the patients involved.
Yes.
Next question. Did United Healthcare say whether or not they will be accepting telemedicine?
So United, as of right now, we're not seeing them allow telemedicine. But again, as I said about the other insurance companies, best is to verify if something changed.
Okay. Next, someone is actually in Bisbee, Arizona under COVID, not returning to Colorado yet. I am now licensed last month in Colorado, and Arizona has not returned my application request. Can I treat via telemedicine people outside of Colorado or only where I'm licensed, not billing insurance? If you're licensed,
I don't know if you're licensed in Arizona or not, or that you're waiting for your license, right? I would say hypothetically, if you were licensed in Arizona and in Colorado, you can treat your Colorado patients. However, if you don't have license in the state which you reside, you cannot treat patients in Colorado unless Colorado or Arizona allow open state lines, right, where you can treat anywhere. So you need to check with your states, but the law says that you need to be licensed in the state that you currently reside and the state that the patient resides.
Okay. Well, I don't see any other questions in here. So unless there are any questions that are coming through in the next couple of minutes, I did see one question about consent forms. So that's not something that you have access to, but I do know that people were saying that the American Acupuncture Council, which is malpractice insurance, that they actually were sending out a consent form to allow for telemedicine.
But you definitely need a consent form with your patients, just in case your data gets compromised. You don't want to be sued. So you need to have a consent, and you need to make sure that the consent mentioned that in the event that the data is compromised, you're not liable.
Perfect. Well, I cannot thank you enough for your time today and your time every other day that you've been doing this. We will be resuming next week. I'm going to take the rest of the week off for the holiday. So next week, we're going to resume with Washington, Florida, Massachusetts, Illinois, and then we're going to end it with Washington, D.C., Virginia, and Maryland on Friday. So if anybody practices in any of those states, please feel free to join us. Again, thank you to everyone for joining us today. I hope you all have a fantastic day, and Sarit, have a great holiday. And I will see you next week.
Yes.
All right. Thank you. Bye, everybody.